First of all, it is important to understand that keeping the intrarenal pressure in the normal range during the whole procedure is the essential, is very important. Either with this or either with fans, if we're reaching that point, we're safe. I do not use only one system. Most of the times it is this and fans. For example, in the small calyces, you cannot go with the fans. And here, this is very important. You can clear also, not only decrease the intrarenal pressure, but also clear the stone particles which are generated. On the other hand, for the bigger fragments, if you want to evacuate and you do not want to lose times, you can work again with the fans. So basically, keeping the intrarenal pressure down and having the possibility of irrigating and aspirating the fragments is the essential part. I really believe that these miniaturizations are needed, considering that there are also children in whom we should do the surgeries. In these cases, the smaller the scope, the better, because you are going to use the smaller sheet and eventually you can do the procedure. The same outcomes with the smaller ones, why shouldn't you use it? You know, the current research is going on to have one system, one scope, I don't know, one thing that will cover everything. Me personally, I don't think that we need one thing, one scope to cover everything. We have a lot of cases, different case scenarios. So I really believe that we need different also instruments for each case scenario. I think that we could think of having smaller channel individualized for the work. It's a working instrument to pass the laser fiber or any other fibers. A basket could be. So having a separate channel for the working instruments would really minimize the effect on the irrigation and obviously the intrarenal pressure changes.